Hi everyone, today I am going to discuss about hypertension stages and the terms we use in hypertension. So this is according to American Heart Association guidelines based on 2017 guidelines. So what is normal blood pressure? SBP means systolic blood pressure, DBP means diastolic blood pressure. SBP normal is less than 120 millimeters of mercury and diastolic is less than 80 millimeters of mercury. That is a normal BP. Coming to the elevated blood pressure, that is systolic blood pressure will be 120 to 129, in between 120 to 129, and diastolic will be less than 80. That is called elevated BP. Coming to hypertension stage 1, here the systolic blood pressure will be 130 to 139 and diastolic will be between 80 to 89. In stage 2, the systolic blood pressure will be more than or equal to 140 millimeters of mercury and diastolic blood pressure will be more than 90 millimeters of mercury. If a patient has SBP of 139 and a diastolic of more than 90, it is considered as stage 2. Higher the value, that is the stage to be considered. Whichever is the higher stage, that should be considered. Coming to the isolated systolic hypertension. Here, the systolic blood pressure will be more than 130 millimeters of mercury and diastolic will be less than 80. Similarly, isolated diastolic hypertension. Here, the systolic will be less than 130, but the diastolic will be more than or equal to 80 millimeters of mercury. Coming to the next one, ambulatory blood pressure monitoring. So here, it is also called Abpm. So here the 24-hour BP will be calculated and there are 3 criteria. More than 1 or equal to 1 criteria can be considered as hypertension. So here the 3 values are 24-hour mean value, daytime mean value and nighttime mean value. So in 24-hour mean value, if the systolic is more than or equal to 125, diastolic is more than or equal to 75 millimeters of mercury is considered. In the daytime, systolic more than 130 or diastolic more than 180 is considered. In the night time, systolic more than 110 and diastolic more than 65 is considered. Any one of these criteria can be considered as hypertension. Coming to 2 important terms, white coat hypertension and masked hypertension. So we should measure the blood pressure of these patients in the clinic and outside the clinic, or that is home, clinic or and home. So in white coat hypertension, at clinic, the BP will be raised and in home it will be normal. Masked hypertension, at clinic the BP will be normal and in home the BP will be raised. So thanks for watching.